It feels like you don't have a choice.
Abortion rights is the stance for nearly everyone in this crowd, but there are others who are anti-abortion. And for the founder of Not Forgotten Ministries, the Supreme Court's decision is a win.
I'm just thankful, that lives will be saved from this ruling, but also as a person who's had an abortion and has experienced the shame and guilt and just a lifetime of regret, I'm really looking forward to just there being a lot of women saved from this.
But this action is just the start of what's to come. Many now looking ahead to upcoming state elections to help play a part in the next move.
We're so mad that right now I'm willing to put the work in to see the policymakers that are going to vote for things and create policies that I believe in.
Other calls to action involve donating to abortion funds too.
They all need our money. It's not okay. It's not enough to just be here and to sit at home and feel hopeless when you have the money and the resources to give back.
A community effort to address a human rights decision.
But it is not the end. We will continue to fight for a better future with personal freedoms and bodily autonomy, not just for pregnant people, but for everyone.
Brianna Harper, WCNC, Charlotte.
And right now we are continuing our team coverage here on this topic. Of course, today's high court move did not happen overnight. It was decades in the making. So many are wondering, how exactly did we get here? WCNC Charlotte's Austin Walker joining us now with that piece of the story. And so, Austin, there is an extensive history behind today's ruling.
Yeah, experts have told me all day today, of course, this is a landmark decision, but it's not bombshell either, meaning people knew it was coming. But to understand how we got here, we have to go back and explain what happened almost 50 years ago at the start.
Pre-Roe, it was the state's decision.
Moving to March 1970, attorneys filing a lawsuit in U.S. federal court on behalf of a Texas resident who wanted to terminate her pregnancy. The case, Roe versus Wade, arguing Texas's abortion statutes were unconstitutional. Following the decision, years later, an all-male court found abortion a federal right, moving away from laws made state by state.
Roe versus Wade itself, right, when it was decided in 1973, started a pretty dramatic battle.
John Schmier, a professor of political science at UNC Charlotte, says historically it's been split on the decision.
It became intertwined with the debate over the Equal Rights Amendment.
Through the years, changes to the law. 1976, the Hyde Amendment passing, prohibiting government funds to be spent on abortions except for cases of rape, incest, or threat of life to the mother. In the 90s, Planned Parenthood versus Casey, the outcome setting the line of pre-viability.
Casey changed the rationale behind the right to abortion. It was a little bit murky in Roe versus Wade.
Ultimately, giving a little more power to the mother carrying the pregnancy.
In the 2000s, we start to see cases, that are centered on things like late term or so-called partial birth abortions.
At the time, a push from legislators to give time frame on when someone can get an abortion and under what circumstances. November 2003. President George W. Bush signing the partial birth abortion ban, prohibiting doctors from performing late.
About 1 minute to go. About 1 minute to go. Proceed.
Health officials have now confirmed the first case of monkeypox in Mecklenburg County. The rare but potentially serious illness typically involves flu-like symptoms, swelling of the lymph nodes, and
Good afternoon and welcome to this virtual media availability. My name is Bill Carroll with the Mecklenburg County Public Information Department. At this time, I'd like to turn the meeting over to Dr. Raynard Washington, Mecklenburg County Health Director. Dr. Washington.
Thanks, Bill, and good afternoon, everyone. Thank you all for joining us this afternoon. I am joined today by Joyce Smith, who is the county's Communicable Disease Director, and today we're here to provide an update on monkeypox. As many of you know, last week the state announced the first case of monkeypox in North Carolina. We have seen an uptick in cases in the U.S. over the last several weeks, and also other countries where monkeypox is not endemic. Over the weekend, we confirmed another case, or the first case here in Mecklenburg County, among a resident of Mecklenburg County. That resident is home and isolating. And we provided more details about monkeypox in the press release, so I won't go through those details on this call. But certainly we are here today to answer any questions you all may have about it, specifically monkeypox, what people should know. The biggest message is obviously we're encouraging everyone in the community, if they have any symptoms that were flu-like symptoms, along with the swelling of their lymph nodes or a rash, to contact their medical provider and to get in touch with their medical provider, who can then follow up as necessary. Just a little bit of high-level background on monkeypox. It is not a sexually transmitted infection. It spreads most commonly by skin-to-skin contact. Individuals typically have those symptoms I just described, flu-like symptoms, swelling of their lymph nodes, or a rash of some sort that eventually fills with fluid and scabs over. It can be confused for STIs like syphilis or herpes, or it might be confused as well for chickenpox. So it's important, given the fact that it is, again, its presence here in the U.S. is increasing. It's important for people to be on the lookout. The infections do remain relatively rare. I believe in the U.S. there are just over 200 confirmed cases, but certainly we know that may be an underestimate of how many cases are truly here. We also encourage our medical providers in the community to be on high alert. We've sent out a number of communications to those clinicians. We also have had a number of preparatory webinars and trainings, and our team has been preparing for the last month or so for this to occur. And as we're here, I'll take a moment just to say thank you to all of our public health team who have been working so diligently to prepare our community for when monkeypox made its arrival here. And certainly we are working every day to continue those preparations in the event that we have additional cases. Our communicable disease team has worked diligently over the weekend to make sure we identified and contacted any close contacts of the case and informed them of their potential exposure, as well as have worked to ensure, our clinical team has worked to ensure that we're able to vaccinate as needed for any of those close contacts. So with that, I'll take a pause here and see if there are any questions from the audience. I think any other details you guys can read in the press release.
First question today is from Claire Donnelly, WFAE.
Hi, Dr. Washington and Joy. Thanks so much for doing this. So I wanted to see if you could give a little bit more information about how the county has been preparing for possible additional cases. And then I wanted to ask if you guys have the monkeypox vaccine and any plans to administer that if necessary.
Sure, yeah. So there are a whole host of activities that have been underway within the health department to prepare. That includes obviously preparing. Our clinical services team under leadership of Glenda Dancy have been working to prepare in the event that a patient presented to the clinic with symptoms similar to monkeypox. As you know, we do quite a bit of treatment of sexually transmitted infections in our STI clinic. And so it was important for us to make sure our team was prepared in the event that there was a patient in our care. Also, we've been working to inform and educate our community providers through a variety of mediums, both webinars and written communications, to be aware of the signs and symptoms. We've also established an incident command structure within the health department to help us manage through this work, as we typically do in these kinds of situations. As well as convened our partners at the healthcare systems and other key players in the community that may be a part of any kind of response efforts. The second question you asked was related to vaccines. There is not a monkeypox vaccine specifically, but we are able to use vaccines that are typically used to prevent the spread of smallpox. And so our team is also prepared and preparing and have are able to administer the smallpox vaccine. We are waiting on additional supply of that vaccine to be shipped to the county so that we can have it in stock here. But certainly at this time, the CDC is not recommending any community level or population level vaccination efforts. So we're prepared and are ready to vaccinate close contacts and individuals who may be exposed in an occupational setting. Joy, I don't know if I missed anything, but if anything you want to add, you can feel free to jump in.
Hi, Dr. Washington. It's Kendall Morris with WCNC. I just wanted to ask if you have been able to pinpoint exactly how this person came to have monkeypox, or if you know maybe who they got monkeypox from.
Thanks for the question. And yes, we have been able to identify the likely source of transmission. And so at this time, we are not concerned about community transmission here in Mecklenburg County. We believe we've been able to trace it to out of county individual out of county. And so that's what we have at this time in terms of information about that.
Hey, it's Morgan Francis from Queen City News. Last week, health leaders announced the first case in North Carolina, but they didn't say specifically where it originated from. Is this that first case, or would this be considered the second case in the state?
Thanks, Morgan. I believe this is the second case in the state, but I would refer you to the North Carolina Department of Health and Human Services to confirm that.
Hey, Dr. Washington, Brett Jensen. You talk about smallpox. There's a lot of similarities with chickenpox. Can you just break down why this is more important, if at all, than chickenpox or smallpox, or if it's relatively the same and it's just something new? Is there like a grave danger and people should be concerned? Can you just, people hear monkeypox and they start freaking out. So can you just sort of break things down on why it's important, or if it's more dangerous, not more dangerous, whatever?
Sure. So typically, I will say monkeypox is typically not a severe illness. It can be severe in certain populations, specifically younger people, older adults, people who are immunocompromised, patients with HIV, for example. There are groups who it certainly pose a greater threat to. In general, though, it's typically not a very severe illness, and it's what we call self-limiting, in that it tends to resolve itself in about 2 to 4 weeks without any kind of medical intervention. Typically, most of what we provide to patients with this are just sort of supportive care that might be needed to deal with the uncomfortableness of the symptoms of the virus.
Next question is from WSOC TV. WSOC TV, you're up.
Hi, wanted to follow up on the vaccine shortage. Can you elaborate on that a little bit? The reasons for the shortage, timeline for getting that?
Oh yeah, so I wouldn't call it a shortage per se. As you well know, smallpox vaccines are not recommended universally any longer, and so we don't maintain an inventory of it, and are just waiting for additional vaccine doses to be allocated to us. And I don't know exactly the timeline, so I can't provide that detail, but we do believe it will be in short order.
Brett Jensen, do you have a follow-up question?
I do. Dr. Washington, completely different topic. While I got you here, while we all have you here, anything new that we should know on the COVID front?
No, I don't think so. Yeah, I think we continue to see, generally speaking, our trends are largely headed in the right direction in terms of the uptick that we have been experiencing over the last several months. And so I think we are headed in the right path. I do believe that we would expect, of course, though, potentially another increase of cases and another seasonal surge in the fall. But we're watching things very, very closely. I believe our report this morning on wastewater showed pretty much flat trends with a little bit of activity at one of the sites. And so we continue to monitor that very closely. Our hospitalizations continue to be low. So at this time, other than the excitement of vaccines for our young people, which we are working quickly to make sure that those are available to everyone in our community, that's the big news on COVID front right now.
Claire Donnelly has a follow-up question.
Yes, thank
Just
you.
quickly, I'm sorry, Claire, to interrupt you. I just
Okay.
want to clarify for Kim, I do believe that the additional vaccine that we were expecting may have arrived just earlier today, a little bit earlier today. And so it may actually already be here. So I just got a text message saying it was here. So
Very topical. We appreciate that. So that's what I was going to ask is, how many were you waiting on? And was that from DHHS? Like, does it get allocated how COVID vaccines were, where it goes from the feds to DHHS and then to you all?
that's an excellent question, Claire. I'm gonna actually see if Joy has any insights into the shipping, how all the hands it passed through to get here. I'm not sure exactly where this allocation came from.
Next question.
Joy, you're on mute. Hold on, Bill.
Go ahead.
I can't hear you.
Next question, Kim Holt, WSOC TV.
Hey, Claire, we'll get your answer.
Come on back,
Thanks.
Claire.
I was reading in the release from the county. It says that in the U.S., a lot of the cases involve men who have sex with men. Just curious, how do we, in reporting this and sharing this with our community, I'm concerned about stigma, and how do we report this properly without creating a stigma around those who may acquire it?
Hey, Kim, I think that's an excellent and very important question. And so certainly I think the most important thing to understand is that this is not a sexually transmitted infection, and viruses and pathogens don't have any respect of person or sexual orientation. And so in this case, this is spread via person-to-person contact, and just in human nature, people are tending to be around people. And of course, people who are in close contact or having sexual intercourse are going to be in close contact with each other. And so that is a coincidence of where the transmission originated in the US. That being said, I think it's important for people to acknowledge what everyone should be looking for, because in fact, all of those cases were in the US or not among this population. And it's important that everyone be on the lookout. But also it's important to acknowledge that this is not related to sexuality, but it's really related to human connections and how people interact with one another and being in close contact with each other. So I think it's important to share all of those details when communicating about the risk associated with it. But also it's important for us, and we've been working with our community partners to ensure that we also get the word out to our neighbors and that community as well, to make sure that they are on higher alert, even higher alert, because of the greater likelihood of exposure.
Claire Donnelly, go ahead if you have a follow-up.
Yeah, sorry. So in addition to that question about the number of vaccines and from whom, I just wanted to ask, is there a point down the road where you could see, you mentioned vaccinating close contacts. Is that something you're waiting on the CDC to issue guidance about before you start doing? Because I know like New York City, they had a clinic and went ahead and started doing that for at-risk populations.
Hey, Claire, Dr. Washington, I can take that if you want me to. So we do have some vaccine on hand, and in conversations while working this case, I think the state has a plan to have that vaccine available regionally for quick access to local health departments. We actually have identified and been able to properly follow up with contacts that needed prophylaxis. So that has taken place. In addition, based on the exposure criteria and what is considered an actual exposure and recommendation for post-exposure prophylaxis, we don't estimate at this time that there'll be a large need for vaccines, but we of course will be monitoring that.
Oh, so you've already vaccinated some close contacts. How many?
At least one. Did you declare?
Go ahead. Do we have a follow-up question from WSOC?
Yeah, actually, I have two, so I'll just throw them both out there and let you address them. I mean, I think a lot of us on this call remember when Mecklenburg County got its first COVID case, and there was one. The fact that this is skin-to-skin contact, we now have one case. Could you talk, Dr. Washington, how concerned are you about widespread cases developing? So that's part A. And part two is, can you tell us any more about the one confirmed case, how the person is doing?
Sure. So in terms of concern about widespread cases, certainly more cases is possible and likely, either not necessarily from this case, but from other opportunities for transmission in the community. It's certainly likely. I will, to be clear, this virus does not spread nearly as easy as COVID. It is much more difficult to transmit than the COVID virus is, and so it's a different level of severity. And severity of illness with this virus is also different in that it is uncommonly severe, meaning that most people recover and don't have any longer term complications without any medical intervention. So I think it's two different discussions completely. The talking about COVID, which is a respiratory virus that spreads very easily and can cause very severe illness for a lot of people. And monkeypox, which is rare, really rare at this time. And we're working, Joy's team and all of us in public health are working very diligently to continue to contact trace and avoid that we're and ensure we're working to disrupt transmission whenever possible. And so these communications like this and our communications to the public, our partners and providers are our opportunity to really try to intervene before transmission starts to increase in the community.
Any follow-up questions?
Can you say how the patient is doing overall, and do you know where they got it from?
So we do believe we've identified the source, and that is as much as I can say about that. I did mention earlier it was the source. We do believe it was an out-of-county resident. And then I'll pass it to Joy. I have not spoken to the patient myself, but Joy's team has, and I think she can talk about their status.
Yes, the team has been in touch with the patient and will be in touch just to monitor kind of his outcomes, and there are no concerns at this time.
Hey, how are you? It's Vanessa Leon from Spectrum News 1. Did you guys say how many vaccines you ordered? I may have missed that.
I believe we're expecting 40 doses to arrive today. So I assume that that's what we received.
And we're not really at the point to where we can order. We're being allocated, so that's going to be determined by the state and the feds.
Next question, please.
Hi, Morgan again. Do you think there would be as much of an emphasis on monkeypox, or do you think that this is just kind of the post-COVID world that we live in?
Great question. I think certainly having gone just through, still experiencing the impact of a global pandemic certainly has everyone a little uneasy and certainly more cautious and more alert to these types of issues. I believe it's really important that we take every action to avoid, continued transmission or increased transmission in the community. We are not expecting this to, again, not to be I don't expect the response the response of this will not need to be parallel to the COVID response, given the differences between the two viruses that I've already described. So again, I don't want to minimize that this is not important, because it really is important. And of course, we don't want to, we want to do everything we can to protect everyone in our community. That being said, it is not the same level of, we don't expect the same level of severity in terms of impact that the COVID pandemic has had on our community.
Next question, please. Last call for questions.
And is that vaccine allocation, those 40 doses, is that from NCDHHS? Who is allocating those to you all?
Yes, we received that from NCDHHS indirectly from the CDC.
Next question, please. Last call for questions. I thank you all. Everybody have a great afternoon.